Hello, everyone. This is Dr. Rahul Anand. Today, I'm going to tell you something about peptic ulcers, how to prevent it, what are the factors we can take care of, what are the lifestyle modificational changes we can do so that we can avoid or prevent this peptic ulcer disease. As everyone knows, this peptic ulcer is one of the most contributing factors which is there with almost all the Indians to some extent. Peptic ulcers are basically caused due to the damage of the intestinal lining, or basically our stomach lining, or intestinal lining, or the esophagus. Right. So there are few factors which, if we take care of, we can definitely prevent them from happening, and we can lead a good lifestyle if we take care of our health. This condition can be very painful if it's left untreated. While there are few factors like bacterial infections and certain medications which contribute to their development, our lifestyle choices also play a significant role in the pathogenesis of this gastrointestinal problem. See, me being a clinician, whenever we see patients on our day-to-day basis, daily basis, almost 80 to 90% patients who come to our OPD clinics, they complain of similar symptoms which are like peptic ulcer disease or acid peptic disorder. So now the biggest question would be how to prevent it, and if it happens, how we can treat it. So these are two main topics which I would be covering here. So coming to the prevention part, let's start with the preventive aspect of it first. So how to prevent peptic ulcer disease? Most of the problems occur to our gastrointestinal system is mainly due to the food habit we have. As we are Indians, we have a habit of eating spicy food mainly. So this is one of the most important contributing factors which does cause this kind of ailment, which is peptic ulcer disease. So, if we cut the amount of spices and oily food in our food intake on a daily basis, we can definitely prevent these peptic ulcer diseases from happening to us. Smoking is another very important contributing factor, which does cause this peptic ulcer disease to a huge extent, I would say. So, cessation of smoking is also very important because smoking increases the risk of developing peptic ulcers and also impede the healing for the existing ulcers which are already there. Now, quitting smoking or avoiding all kind of tobacco products goes a long way in reversing peptic ulcers and preventing their recurrence. So this is a very important factor. Having plenty of fluids in addition to taking good food, non-spicy, less oily food, and taking a lot of fluids with that will definitely help in preventing this acid peptic disorder or peptic ulcer disease. Another biggest contributing factor in this age with the millennials we have is the stress management. Practicing stress reducing techniques such as meditation, yoga, or deep breathing exercises helps alleviate psychological stress, which can contribute to peptic ulcer, which can contribute to prevention of this disease. If we change our lifestyle to a healthy one, which includes definitely food habit and then management of our stress. So these are two very important factors naturally which cause peptic ulcer disease. Now there are certain drugs which can also contribute in these kind of disorders. Certain drugs like your non-steroidal anti-inflammatory drugs like NSAIDs, or in very common language we call them painkillers, or not all painkillers though, but there are few classes of painkillers which we call NSAIDs, cause a substantial amount of peptic ulcer disease to us. So, as a clinician, I would say that we should be very cautious in using them. And for the patients who go to the pharmacies and take over the counter pills, they should be also very cautious in taking the painkiller medications because their prolonged usage lead to this peptic ulcer disease. It is, if it's feasible to prescribe other analgesics for chronic pain management that do not deleteriously impact the gastrointestinal tract, we should definitely try to do that. Physician consultation before a long-term drug use is very necessary here. Now, we have already discussed few points regarding how to prevent this peptic ulcer disease. Now, coming to the management part. During my talk about the prevention, I had mentioned few points like lifestyle modifications, Consuming foods rich in fruits, vegetables, and whole grains, which provide essential nutrients and promote digestive health, can help us in managing the peptic ulcers in our gastrointestinal tracts. Again, limiting spicy food, caffeine, alcohol, acidic beverages, as they can irritate the stomach lining and exacerbate ulcer symptoms. And adding probiotic rich foods in the diet, yogurt, kefir, to maintain a healthy balance of the gut bacteria. These are few dietary modifications which can definitely help us in preventing or treating the peptic ulcer disease. One a very important pathogen is there, which is generally known as Helicobacter pylori. This infection is very common in this Indian plethora. So this is one of the biggest factors which plays in getting these kind of disorders. Many times for this H. pylori infection, there are surgical interventions are also needed if the ulcers become larger in size, more than equal to 5 millimeter in diameter. When they do not respond to the medical therapy, then we need to get the ulcerations treated through surgeries also. Again, staying hydrated by drinking plenty of water throughout the day also helps prevent peptic ulcers. Adequate hydration supports proper digestion and help maintain the stomach's integrity basically. Obesity is also a very important risk factor for peptic ulcer disease. Engaging in regular physical activity such as walking, swimming, or cycling promotes overall health and reduces the risk of obesity, which in turn will help us either minimize the risk or prevent the disease, or if we have already gotten the disease, these lifestyle modification changes may help us in treating the disease as well. Implementing lifestyle changes, dietary modifications, and following a regular exercise regime can reduce the peptic ulcer risks and support the overall health of your gastrointestinal system. A physician's advice must be sought before taking medications for peptic ulcer or altering any drug. Now, coming to the drug part. Presently, drugs which are being used to treat peptic ulcer disease include proton pump inhibitors like esomeprazole, pantoprazole, rabiprazole, and few other drugs which are also used to treat these disorders are H2 blockers, drugs like H2 blockers or sucralfates or alginates. We can use them. But the proven treatment for these peptic ulcer disease, if a person has already had it, is the proton pump inhibitors, which work really well. At times, to treat Helicobacter pylori infection, we have give antibiotics as well to the patients at times, but not always. So the take home message from my entire talk is here. First comes lifestyle modifications, which include cessation of tobacco use, eating right and healthy, keeping yourself hydrated at all times, managing stress, taking painkillers very judiciously. These are very important points how we can prevent the peptic ulcer disease from us. And the most important point here would be if you feel any kind of symptoms, which may start from having a heartburn to abdominal discomfort to a irritation in the neck, in the throat, do consult a doctor always. Consultation with a physician should always be done. Self medication should be avoided because self medication can lead to few disease processes which might prolong the recovery of the ailment. So these were few important points regarding peptic ulcer disease, starting from how to prevent it to how to treat it, what are the symptoms, and what to do and what not to do. I would like to add few more important points here when the alarm should be raised. At times, when the peptic ulcer disease progress, one might get pain in the stomach or in the upper part of the chest so severe that the patient might require hospitalization. The patient might start bleeding from the mouth, or the texture of the stool might change. So these are few important points which needs to be taken care of. Once the disease is identified, it should be treated by the doctors, by the medical professionals. So that would be it.